So welcome to this NUS Medicine info session for the Master of Science in Behavioral Implementation Sciences in Health. It's quite a mouthful, so we call it MSc-BIS in short. My name is Jen. I am the Program Manager for this Master Program, and I'll be your host and moderator for today's session. So first and foremost, I'd like to thank everyone for taking your time off this evening to join us. We've welcomed our very first batch of students in August of 2024, and for August 2025, we will be welcoming our second batch. And hopefully for some of you here in the audience tonight, you will be joining us this year. Now, on behalf of everyone in the program, we appreciate interest and we hope to look forward to exchanges with you during the next 1 hour of this session. So without further ado and without me talking too much, I will introduce the first speaker of today. Give me 1 second. Well, his name is Professor Nick Sedalis. He's our Academic Director at the Center for Behavioral Implementation Science Interventions, or BZ in short. He will take you through the overall introduction for the degree program. So without further ado, over to Nick, please.
Wonderful. Jen, thank you very much. I hope everybody can hear me. Welcome, everyone. Thank you for your interest in this program. As Jen suggested, this is our second intake. We are very excited about running the program. We're very excited this time last year when we first launched it, and it was wonderful to welcome our first cohort of students. We are improving and adjusting the program as we go through our first academic year, and we're really looking forward to year two. So essentially what I'll do with you tonight over the next 5 minutes or so is to just set the scene, if you like, which I'm sure you've already done in terms of a bit of background reading, and you're interested in being here to talk about a master's level, postgraduate level taught degree in the space of behavioral and implementation sciences applied to health. Essentially what we're teaching you is what this slide summarizes. Behavioral science is really a broader term. We don't just look at psychology, but we look at all sciences to do with human behavior, sciences that combine insights from psychology, but also cognitive science, social sciences, organizational sciences in terms of what might drive positive health-related behavior or behavior change. And we do that at the level of an individual healthcare provider, an individual member of the public, and we supplement that with implementation science, a field that's come together over the last 20 years or so to offer a more organizational, if you like, approach to how we mobilize evidence, interventions, and technologies that we really know work, they're effective in improving population level health and health outcomes. How do we mobilize those more effectively to reach patients, to reach populations at large through our healthcare systems? So we use both of those because we don't think you can achieve population level health improvement, healthcare delivery improvement without using both of those sciences. That's why we bring them together into our center of the master's program. So as you'll see in the next slide, what we're essentially trying to do here is to prepare people who come essentially from all walks of life. Our students come from behavioral sciences, economics, they come from medicine, they come from management. We believe that if you are to consult, if you are to lead, if you are to carry out research of the next 5 to 10 years in the space of improving health and healthcare outcomes, you do need insights from both of these sciences. We see the world today is a very complex environment in all healthcare systems, no matter how well funded or how advanced they are. We need to understand how to better design and implement healthcare and public health policies to ensure the maximum effect for patients, but also for populations. You'll see on the next slide that one of the reasons why we're going on so much about the need to address a complex world and a complex environment is because we're really faced in healthcare with fairly complex challenges. So you will see that what we've outlined on our slides, Jen, if we can get to it, is this sort of complex world that we live in where healthcare expenditure is going up, and that includes places like Singapore where we can afford, but the question is for how long and to what outcome. And if you look at the more global picture, we know that we have healthcare systems that work under increasing pressures and with policy and political perturbations, as you see major healthcare organizations these days having to cope with changes in the funding environment and so on. We also know that there are several unsuccessful attempts to sort of downstream innovation that goes sort of top down. We try and understand that. That's what really is the bread and butter kind of theories and methodologies that we're teaching on this masters. And of course, we have been saying for the last 20 years almost within the health industry that we need to move on with prevention, move prevention nearer people's homes, their families, their social networks, rather than wait until people get sick to sort of treat them. So if you take all of these global trends and you put them together, this is really the rationale for learning and combining those insights and methodologies that cut across those two fields. We're very proud to say we're the only such program in the entire continent of Asia who's actually offering this level of combined expertise. So move on to the next slide. Essentially, this is my concluding slide to say that we want to equip a new generation of scientists, a new generation of policy advisors, potential policymakers, and indeed clinicians, for those of you who have clinical healthcare backgrounds, to be able to reconceptualize these challenges in novel ways, to throw novel methods, think of the evaluation approaches in different ways towards these challenges, and actually help deliver the sort of transformation level change that we do feel we need, not just in Singapore and Southeast Asia, but in several healthcare systems around the world. We are preparing people, we hope, who will be working across the global sort of healthcare industry. So this is the vision. This is really what I had to say today. Before we move on to some more practical aspects of the master's program, we're absolutely delighted to be introducing my colleague, Dr. Aoife Keohane, who is the overall program director. She runs with the help of a large team of us, the master's program. So Aoife is a senior lecturer in the School of Medicine of the National University of Singapore, and an absolute phenomenal colleague. So Aoife, the floor is yours to talk about the content of the master's.
Brilliant. Thanks very much, Nick. Happy to see you all here. So the main aims of the Masters that was set up a couple of years ago, and we're nearly finished the end of our first run, was to develop excellence in knowledge and expertise of behavioural and implementation science as applied to healthcare settings. And as Nick said, this is one of the first Masters, not only in Asia, but in the world, that combine behavioral and implementation science. So the idea of the Masters, and kind of as it works together, it's to master methodological and statistical approaches to evaluating this kind of implementation and looking at the impact of evidence-based interventions. And we bring in behavioral sciences as well. We bring in program evaluation and different things like that. And I'll take you through some of the courses that are involved as well then as well. So it's a 40-unit coursework. This is kind of generally the system with NUS with the master's program. Each course is 4 units. And then you need to do 7 core courses. So all students will have to do 7 of these courses, which we'll talk about in a second, to get the 28 units. And then you have a choice of 7 elective courses. This might change in the next few years, but these are the 7 elective ones that we've chosen that are we feel that are the most relevant for our students and people working in the field in implementation and behavioral science that would be useful for them moving forward. It's the first hybrid master's program in NUS. We have 2 of the courses that are delivered fully online, which can be really handy for some people if they're working. There are other kind of things that they have to do as well. So we have those 2 sessions that are delivered completely online, so you can do those and work from there. But the rest of them are face-to-face, especially a lot of our methodology courses. We really want interaction. We want to do a lot of workshops. We do a lot of workshops and interactions with our colleagues, and there's a lot of kind of hands-on stuff. It's not didactic teaching. We've moved away from that kind of thing where you're sitting there for 3 hours just looking at a lecture. We come in, we bring facilitators, colleagues, researchers and experts in the field, and we all kind of work through different projects, different case studies and things like that, because we want you to be able to practically use this knowledge in the future. So that's kind of the main overview of the Masters. And of course, our target audience, which hopefully will be many of you. If you don't fit in this, please ask us questions, because it probably is likely that it can be applicable to you as well, are generally healthcare professionals, management teams, policymakers, and thought leaders in healthcare. It can also be relevant for health scientists, behavioral scientists, and implementation scientists, and people working in the health services as well. I spoke to some of my colleagues today, some people working in social care and social services. This would also be very relevant for you as well, even though more of our examples might be healthcare examples, but we will talk about services in the community and different things as well, so we can work with that as well. So it is applicable if that's something that you're interested in doing. The master's, as a full-time person, you can do it over 1 year, but you can extend it to 2 years. Some of our students are already doing that. They realize they want to take more time on their master's project, so they're extending it for the next semester. And then for our part-time students, they can do it over 2 years, or they can extend that to over 4 years if they feel the need, depending on work or other obligations. And our next intake, which Jen will go into in an awful lot more detail, is in August 2025. So hopefully that's why you're here, to find out a little bit more about this. So these are our core courses. So all of the students will have to do these core courses, and the first few are in the first semester and the next ones in the next semester. And of course you adapt to this if you're going to do it full-time or part-time. If you're going to do part-time, you might do 1 or 2 in the first semester and then build it on and do some more of them in the second or third semester as well. So fundamentals of behavioral and implementation science is exactly what it is. It's about the core concepts, the theories, the frameworks that are used in implementation and behavioral sciences. Of course, we only introduce them here. Remember, we can't explain all of them. There are lots of frameworks and different things. So we'll give you examples of ones that we've worked with it and get you to kind of work with some of them as well. And maybe you'll discuss other ones. And in your project, you might bring in other ones that we can discuss as well. But we won't obviously cover all of them, but we'll introduce them so you know how to apply them and use them in your workplace. This is supported then with the intermediate research methods, which will look at the more methodology side of things. So we look at methodology, study designs, and outcomes, and how we can use that in your research. So that complements that course really, really well. And then we have program evaluation in health, and this focuses on health program evaluation, and it gives students the skills to prepare and communicate evaluation results, and it helps you again to work effectively with stakeholders and decision makers. A lot of this we will touch on this in some of the other courses as well. Some of them overlap, and we bring in some similar people so we can work together. So there is some overlap, but we want to kind of connect it so you look at it from different areas: program evaluation and stakeholders, implementation and stakeholders, behavior and stakeholders. So the idea is to kind of make it a kind of holistic approach. This is also then supported by our Master's Project 1 and our Master's Project 2. That's our kind of dissertation course, or our capstone project, as some of you might say. So you'll start your Master's Project in semester 1 as a full-time student, and then you'll complete it in semester 2. So there are options for some of you who might be full-timers, people who are working in healthcare themselves and might have idea of projects that they're interested in working in. So there's space for that as well. We might talk to you and kind of work with you and see if there's supervisors to support you in that as well. For those of you who have no idea what you want to do, of course, we have supervisors and people who want to work with you and help you work on projects to help you learn as well. So that's kind of our master's project as well. So for the next one, the electives, we have, thanks, Jen. We have 7 elective courses, which you will only have to choose 3 of these. So some are in semester 1 and some are in semester 2, and then they repeat every year for our part-timers. The introductory research methods is generally for the people who might be out of research for a while or even new to research. So it's kind of a revision or an introduction to statistical methods that you might use, qualitative methods that you might use as well. So to get you more familiar with those, that's like a short course just before you start your actual master's. And then we have other courses like behavioral decision sciences that is run by our excellent colleagues. And then we also outsource some of our courses. Some of our colleagues are doing great stuff in other departments in NUS, in digital agility, medical data, and data processing. So students can go and do some of those courses with them because they're doing it really well. So I think that's a really good idea. And then in the next semester, some of our other colleagues here do this advanced research methods. So this is really for the people who really want to do research in the future, potentially want to do a PhD, or really want to look at like complex interventions, hybrid designs, kind of more complex stuff. So that we'll do that in a lot more detail for some of our students who are interested in that path. And then some of our other students are might be more interested in advanced applications or kind of practitioner stuff. So we have this other course, which is advanced applications, which kind of looks at case studies and different things and working through different applications in behavioral and implementation sciences. So that's kind of the choice of our electives. So you can choose 3 of those then, and we can discuss that. I mean, you might just change your mind when you go with the other courses and how you want to do that. So there's flexibility for those. So for track specialization, we give you the offer of doing a specialization track if you're interested. Some of our students are interested in kind of going down a more research path. Some of them are interested in going more down a practice path. So there is an option to do that. If you're more interested in research, we would recommend that you do this behavioral decision sciences and the advanced research methods. If you're more interested in practice and you want to do practitioner and you don't really want to go down the research, we would recommend that you do those. Some of our students haven't really figured that out yet, so they will do bits of either. So this is just an option if that is kind of more your focus. But of course, we are there to support you in your decision making as well. For the next slide. Yeah, so there is also this option for some of you who might already have PhDs or be totally overqualified already and go, well, why do I want to do this? It's also interesting for some people who might want to just learn a bit about implementation science as well. We do have these stackable certificate programs that you can do, and we do all of the courses that I've just described as well. If you want to learn about the theories and frameworks, you can do these online courses, which is the fundamentals and the intermediate behavioral. They're the two that are in green there, number 1 and number 5. And then for the others, then if you're interested in policy and want to learn a bit more. So you've got these options if you want to do some of these courses as well. And we do have some students who do that. They might be doing a PhD, but they want to build their knowledge as well. So there is a bit of flexibility for those who might not want to do a whole PhD again. And there's also this, which I think is a really nice setup that Jen and Xiaoxuan have built these 2 graduate certificates. So if you want to get this nice graduate certificate in fundamentals, so you can use that if you want to work. And then if you're already kind of maybe working in that area and you just want to have the certificate to go with it, you can do it that way. You can choose 3 of these and do those certificates. Or if you want to come back then in a few years and do the more advanced stuff, you can do the intermediate. So there are all these kind of options depending on kind of what you're interested in, the master's route. Maybe you're already doing a PhD, so you want to just do that or anything else. So we're happy to discuss that as well. So as Nick has kind of introduced, we have lots of different faculty and we don't have time to go through all of these slides here. But Nick has been the director. He's been here for the last few years. So he's been setting this up. He's been doing this in the UK as well. And he's got worldwide experience in all of this. And he's supported by Professor Robin Milton, who does great work as well with CEI, and she's involved all over the place as well. And Joanne Young, who's also one of the course leads who does the program evaluations, who, if you haven't heard from her, she's exceptional, so you should watch her as well. And then there's other teaching faculties that support us in different ways, and they teach on different courses in psychology and in the behavioral and implementation sciences. So these are other people who are experts in policy. Tiki works in the WHO, so we've got Professor Tiki, some really good knowledge in that, and he actually ran the conference last week as well. And there's all of these other people. So there's a lot of support and a lot of different people and different knowledge that we kind of bring in because it's useful because they come from different fields, from social sciences and policy and psychology and epidemiology. So it's a nice kind of group of individuals. And now I'm going to pass you over to Jen, who's very knowledgeable and will explain everything in very detail for applying and how you can apply to the course. Thanks, Jen. Thank you.
Thank you, Aoife. Yeah, okay, so I think we've covered most of the information you will need to know for this master degree program in terms of the overall objective of the program, what you will learn on the course. So my role here tonight is to share with you the bit more logistical and administrative details about applying to the master degree program. So I'll first touch on, for example, what will be a requirement or what kind of background knowledge we would expect our students preferably to have when they apply to the program. So I think Aoife has already mentioned about the target audience. So it is anyone who has any kind of experience within generally the scope of healthcare, whether is it in Singapore or around the region, you are welcome to apply to this program. As also mentioned by Aoife, as the program covers a lot of aspects of behavioral and implementation science as a science itself came with a foundation or a background in psychology. So if you have background in those areas, you are also very welcome to apply. We also welcome candidates who have experiences or past degree programs in social sciences and social work or other related fields to these. We are also happy to review and welcome your application. And then on top of that, as I mentioned, anybody with some kind of healthcare or medical related background, you can apply. So that also includes our basic science colleagues. So if your background is in, for example, cell biology, molecular biology, or even biochemistry, or any of the basic science degree programs or graduate programs that you have done before, you are all very welcome to apply. So, so generally speaking, we generally prefer, or we would we will want to see more of our students coming from healthcare background, psychology background, social science, social work background, life science background. We also even have current batch of students who are MBBS holders, so they are clinicians, practicing clinicians within Singapore, nurses, pharmacists, and also other allied health professionals on our program right now. So if you fit into any of these profiles, your application to us will be more advantageous than those people who do not. But fret not, if you are thinking about pivoting into a new field such as healthcare, and you see that our degree program is suitable for you to make this transition for your career, we are also very happy to review your application, because as part of your application, we not only just look at your degrees, what achievements you've done, or what is your working experience. We also want to see a personal statement from you, which you will detail in the personal statement. Why do you want to do this master degree program? How do you think it is going to benefit yourself and your career, or your career growth, maybe in the next 5 to 10 years? And what do you hope to achieve out of this master degree program? All of that will be taken together in the review of the application for everybody. So I've sort of jumped a little bit to the others part, but let me come back to working experience. We also appreciate applicants who come with some level of working experience. Minimally, we hope to see 1 year post-graduation, and ideally, as I mentioned many times, within the healthcare space. But again, fret not, if you do not have any formal working experience, we also welcome you to put in any internship or attachment experiences you've had while either during your undergraduate days or some other experience relevant to this application. You can all put it in the application form, and we will review it accordingly. So your internship or your part-time experience can be from admin, leadership, all the way to research, across any field that may be, you think, relevant for our consideration. And then on top of that, I'm not sure how many of us in audience today do not come from Singapore. You may come from Southeast Asia or other parts of the world. Again, we welcome everybody's application, but just note that as an international applicant, if your primary degree program or the previous graduation certificate that you have was taught in a country or in a university where the main medium of conversation or communication was not English, we will require you to fulfill English test. So usually it is TOEFL or IELTS, and the scores are IELTS is 6.0 and TOEFL is 85. I think these English requirements are pretty standard across all master degree programs within School of Medicine at least. And the test scores that you've done with these two organizations, they are valid for about 2 years. So if you have graduated for a while, or you've done this test some time ago, please double check the validity of your certificate or result. If they have expired, then you should quickly try and get that done before you apply to us. So as I mentioned just a while ago, there's a personal statement that's required. So in that personal statement, just try to convince us that what got you attracted to this master degree program? How do you think it is going to be helpful for you? What you hope to achieve on the program? And how do you think these will help you in fulfilling your career or life goals in the future? And also, as I mentioned, we value working experience. So a CV, your CV will be required for review when you apply to our master degree program. And on top of that, we will require at least one referee or reference letter from somebody who used to work with you, or who was your past supervisor or professor at the university, or a boss, current or past, who can make statements about your learning ability, working ability, your attitude, and things like that. And that is a requirement for application. But we only require one, at least one. If you have more, then feel free to submit. But the minimum requirement, it is just one. Okay, so now let me move on to the next important piece of information, which is about course fees. So it is a 40-unit master degree program by coursework, which means that apart from the 2 master project modules, everything else is through attendance of classes and completion of work assignments, project work, self-written assignments done during the semester. So the overall course fee is at $56,700 without GST. Right now, the GST in Singapore is 9%. So factoring the 9% GST, you're looking at $61,803. The good news for, I think, majority of you in attendance today, if you're a Singaporean or PR, NUS has offered a 40% tuition fee rebate on top of the tuition fee that you see here, which means if you do a quick calculation, it is 40% discount basically of the $61,800. And for any NUS alumni, regardless of your nationality, you enjoy 20% discount. But unfortunately, if you don't fall under below any of these two categories, you will have to fulfill the payment of the full fee. But just to share with you that how the fees are charged is based on semester. So let me explain myself. If you are doing the degree program as a full-timer, which means that you will have minimum 1 academic year to fulfill the entire program requirement. 1 academic year is 2 semesters, which means that whatever amount that you need to pay, you divide it by 2. And you pay that over 2 semesters. The first fee payment will be in August of 2025 if you're thinking about joining us this year, and the second one will be in January of 2026. If you are a part-timer, then you take whatever amount of fee that you need to pay, divide it by 4, you pay it across 4 semesters, because 4 semesters is the minimum candidature for a part-timer. So in that sense, it can be quite manageable if you're thinking about how you're going to, fulfill the payment of the school fees. When you apply to our program on the portal will require $50 application fee charged by the portal. And upon receiving your application, we feel that you're a suitable candidate, we make that offer to you. And if you choose to accept our offer, there is a payment of $5,000 acceptance fee. This $5,000 acceptance fee will be deducted from the overall cost fee that you need to pay for your master degree program. So it is not additional, but it will be subtracted later on. Finance department will automatically process that payment. For application timeline, we open in December. And if you're an international student, because there's more administrative work involved in getting you coming into Singapore after you are accepted to the degree program, the application as of right now is ending at 30th April. For locals, because there's a lot less admin work involved with you guys, the application deadline is end of May. We may consider extending the deadline depending on how the response to the application has been, but as of right now, this is the deadline that we are sticking with. So another piece of information that some of you may be interested to know is, as Eva has mentioned, we offer certificate programs. So the way the cost fee for the certificate program is structured is such that it is charged at a slight premium over the entire master degree program. So the entire master degree program is about $57,000, which is 40 units. So you take all of that, divide it by 40, and you multiply by the number of units you wish to sign up for the certificate program, plus another 5%. I hope that is not confusing. So anyway, the amount is printed on the slide here. So if you're thinking about doing the graduate certificate, which is a combination of 3 courses, you're looking at $19,467 for one certificate. If you're taking one course, that means you're taking the executive certificate, it's about $6,500 per course. And I'm very sorry to say that the university rebate of 40% and 20% does not apply for the certificate programs, which means that you have to pay in full for each certificate program. Having said that, because these are stackable certificates, at some point down the line, if you feel that you want to convert and do the full master degree program, these certificates or courses that you have completed will contribute towards your eventual master degree program, and whatever fees that you've already paid up to that point for the certificates will then be automatically deducted from the overall cost fee that you need to pay for the master degree program, which means you just top up the difference and you complete the remaining of the units to fulfill the master degree program. So having said that, I think there will be quite a few questions pertaining to fees and how to enroll and what does the course schedule look like. I'll look forward to your questions in the Q&A later. And then right now, I have 2 QR codes on screen here. So if you want to find out more about the master degree program, you can scan the QR code on the top right-hand corner on your screen. It will take you to our master degree page where you will see a welcome video. You will see the course brochure with more information and a lot of details about what you will learn specifically for all the courses in the entire master program. You'll also see samples of the timetable across semester 1 and semester 2 for both part-timers and full-timers. And then if you're interested in applying, you can scan the QR code on the bottom to apply through the NUS application portal. And I hope everything goes smoothly for you. So I think with that, we will enter the Q&A section. The first question of the night came from Luke. So Luke, you asked, does the program accept learners outside the healthcare sector who wish to work in healthcare after graduation? I think I have semi-answered this question, but I will let either Nick or Eva take this.
So sorry, this is about the healthcare workers. Yeah, so you don't have to just be a healthcare worker. It is an implementation science and behavioral in health, and we will use examples and case studies in health. But as I said, if you're working in the social care area or in the community or in the nonprofit organizations, this could also be very, very useful for you. It is also applicable for people working in education, because that's what I'm doing a little bit as well. So you can do implementation in education. So there is scope for those kind of backgrounds as well. So it kind of really depends where your background is, but there is space for that. But it is going to be a kind of focus in healthcare. So if you have an interest in that, or social services, I think it will be interesting for you. Nick, I don't know if you want to add anything to that. Sorry.
Okay, all right. Thanks, Aoife. I think Nick can take the next one. The next question is again asked by Luke in the chat. What are the existing roles one can expect to explore post-graduation from this master degree program?
Yeah, I can sort of summarize an answer. So there's two indications of what you might do. As Aoife described, the master's at the moment is set up for people to take a research track or a practice track. So we anticipate that, for example, some of the students upon graduation will be considering to continue into applied health research or healthcare services research. And indeed, I can tell you that we've got a good chunk of our first cohort of students who are now actively applying for PhD fellowships and going through PhD applications. So there are people. So one pathway might be to go into further research training. There are people who, if you think about particularly with the practice track sort of portfolio, if you look at some of the faculty that, if I get summarized, some of these people are basically doing healthcare consultancy. They're running, or they are being employed by third sector organizations, so not for profit organizations who again undertake large scale evaluations for ministries. They get commissioned work and so on. So this is another very obvious direction that we expect our graduates to take, so to get into healthcare consultancy and related kind of work. We have people with healthcare backgrounds who, some of them are already undertaking sort of clinician scientist kind of career trajectories. They need the skills to back up the kind of research they set up. Others are in senior director roles and they want to progress further. So they study on our masters with a view to gain the skills to be able to better implement and facilitate sort of behavior change through their directorships and so on. So I think there's a whole range of roles. We expect we're going to see graduates of our masters working in ministries at some point or other, again across the world, because we have an international cohort within the masters. So these are the potential pathways, I think, for post MSc employment or further study. And of course, there'll be more. We will be tracking where our students go. So in a few years' time, we'll probably have a nice statistics to share as to what are the sectors that absorbed the student body upon graduation from the program.
Okay, thank you very much, Nick, for your answer. I see another question in the chat by Cheryl. Cheryl asked, regarding course fees, if I'm a staff in NUH, will there be additional rebates? So the answer is, I'm sorry, no, there will not be any additional rebates other than the one that's provided by the university. But however, as a staff of NUH, and I know we've done a lot of conversations with senior leaderships within the hospital and the cluster, you can ask for a sponsorship from NUH. In fact, I think we have a couple of current batch students who are from NUH and they are being sponsored by the institution. But there's a small caveat to that. So if you want to know what the caveat is, please email us at busylearning@nus.edu.sg and then I'll share further details with you about company sponsorship. And also, I just want to jump to a question in the Q&A. It's also along the lines of rebate. This person very cheekily asked, if I am a Singaporean plus an NUS alumni, do I get 40 plus 20% rebate? I'm sorry, the answer is no. You qualify for either one or the other. You cannot double dip into the discounts offered by the university. Yeah, that's just not allowed, unfortunately. And also, I'll just quickly get to another question that I think I can help to answer. Xuan Xiu, you asked how many students are expected to be enrolled in this project. Do you mean the master degree program? So currently we have a batch of 47 students, both full-time and part-time. In the August 2025 intake, we hope to achieve between 70 to 80 around that number of new students coming into our master degree program. So I hope that's what you're asking. If not, then please type your question again in the Q&A. Okay, so let me go to the first question in the Q&A. What is the difference between behavioral decision science and research method course? This is Aoife.
Yeah, I can take this one. So the research methods course is the intermediate research. Well, there's an introductory one as well that you can do, but the intermediate one is kind of gives you the methods that you can use. So we will go through some of the qualitative and quantitative methods as a revision if you're new to those kind of things, but it's applying the methods for behavioral and implementation science. So it's all about the methodology and the frameworks and the strategies around that. And we'll take you through projects. We'll make you work on kind of projects being, well, how would you design this? How would you do a study design and everything else? So it's really looking at the methodology. Whereas the behavioral decision sciences is an elective, so you don't have to do it if you're not interested, but it is actually a very interesting course developed by our colleagues, Eugene and I've forgotten his name, but yeah, so there are some very interesting people working on that. And it focuses on behavioral decision-making, like choice theory, and the role of big data and AI in informed decision-making and stakeholder engagement. So they bring in decision-making as well in that and behavioral decisions. So it's different. It's not behavioral science, it's bringing in the behavioral decision. They do, of course, cover some behavioral sciences as well. So as I said, there will be some overlap to help you understand how they kind of work together. But that's the difference between the two courses.
Okay, thank you, Aoife. I think I can move on to the next question. So we have this person, Ai Tong, he asked, I'm from Zhongnan University of Economics and Law, majoring in accounting. I am very interested in the field of behavioral health behavior and have internships in pharmaceutical consulting. I also have a background in quantitative economics. May I ask if a background can be considered?
Yes, we have some students with economic background. Some of our economists, our program evaluation people are health economists as well. So yes, absolutely, absolutely. You would be very valuable. You bring different kind of knowledge. We all bring different knowledge from our different backgrounds as well. So yes, you would be very valuable. Yes, you would be considered. But it is going to be working in the healthcare thing. So you need to be interested in kind of learning about the healthcare if you're coming in and that. But yes, pharmaceutical is relevant as well because they're connected to healthcare.
Anything you want to add on, Nick? Okay, all right, then I'll move on to the next one. Anonymous attendee asked, okay, it's jumping. Are there any examples of extent or the depth of the topics that can be explored in the master's project, given that one has to balance taking the course and doing the project at the same time? And would there be a possible cross-department or industry collaboration?
So for the second one, yes. For the first one, examples, well, we have project list examples. So I mean, if you're interested in figuring out if something is working or not, if you want to implement it, you'd look at the barriers and facilitators, and we'd do interviews. So they'd be different kind of project. It kind of depends on what you're interested in doing. If you're working in the hospital and you want to figure something out about implementing a new app or a new service or something, that's just general examples, but it depends on where you're coming from. So there is flexibility with that. Some of our colleagues are already working on very large projects, so we could bring you in there as well. So yeah, there is examples. Maybe I could talk to you more offline about this. But yeah, there is definitely possibility, and you could be a lot. We have a couple of people who are working in healthcare, and they're using projects that they're working on, apps that they're interested in looking at the implementation side. So we're helping them. Nick is supervising some of those students, helping them figure out how they want to do that. So that's part of their masters. They might eventually publish a paper and do more with it, or it could be a quality improvement project. So we're willing to work with that because we want to work with people to kind of figure out how what they want to do in the implementation and behavioral world. And yes, there is absolutely possibility of cross-department. We love working with other colleagues. That is a big implementation and behavioral word. You need to collaborate with people. There's a lot of stakeholder engagement, and we do work a lot with that. So that's really, really important. Possibility for an industrial collaborator, yes. If you know them, we can talk to them. We don't have any direct ones at the moment, but we're always interested in working with people. So yeah, there is a possibility, but you might have to lead on that if that was your project.
All right, thank you, Aoife. And then I'll get to the next couple of questions. I see that Sihua, you asked whether there are any SSG or SkillsFuture credit or funding that can be applied to this course. So the answer is a semi-yes. So while we do not have SkillsFuture funding for this master degree program or the courses that we run, however, you can use your SkillsFuture credit and mid-career credit claims top up for this master degree program and all of our certificate programs. And also at the same time, I see that there is a person asking for the timing for lectures for part-timers. Are they all nighttime? How would they be delivered? So for most of our master degree program courses, they are face-to-face, with the exception of two that Eva has mentioned in her presentation. So for the classes that are face-to-face, they are generally in the evenings after 6 p.m. So we have classes that run from 6:30 to 9:30 or from 7 to 9 p.m. So it is fully catered for full-time working professionals to be able to attend our classes. The classes may not last 3 hours every day of the week, but it is planned in the schedule such. So you may not have to stay until 9:30 or 10, maybe 9, the classes would end for that week. And yes, if you are thinking about doing full-time, then the load can be pretty substantial. You may find yourself in class every day evening, Monday to Friday, for a particular semester, depending on how much you choose to commit to complete your coursework. For the 2 online classes, they are always in the morning, so either once or twice a week between 8 a.m. to 11 a.m. And all classes are conducted entirely online through Zoom, including your project presentations at the end of the course. Everybody, whether you're doing part-time, full-time, executive certificate or graduate certificate, will be all in the same class together at the same time. We do not repeat classes or overrun classes for different groups of students based on their candidature. But we do have overlapping semesters where we run Master's Project 1 and Master's Project 2, Master Project 1 for full-timers, for example, Master's Project 2 for part-timers. Then only the part-timer class will be in the evening, the full-timers class, because by nature of the fact that you're full-time means you're coming from overseas to attend this most of the time. Your classes may be in the day during office hours. But other than that, majority of our classes, you're right, are in the evenings after office hours. So I hope that answers your question. I can see more questions in the Q&A, but let me get to one here. DP holder considered as domestic student, which means that the DDL of application is the end of May. Thank you. So may I ask Lynn, what do you mean by DP? And what is DDL?
Deadline.
Is it
The second one
deadline?
is deadline, but I have no idea what the DP holder is.
Is it EP, employment pass? Okay, maybe you clarify your question and then we'll come back to you. And then somebody asked, do I need research background?
Not all of our students have a research background, actually. So they're coming from human resources or anything else. It's more of an interest in learning about implementation science and behavioral science. But again, as we said, you can separate into the practitioner track or the research methods track. You should have an interest in research, though, because we will be talking about a lot of research and different kind of studies that have been involved. So we would imagine that you have an interest in research. You might not decide to follow a career in research after the master's, but you would want to read about evidence-based research and studies that have happened, because this is what we're talking about, evidence-based science, and then implementing it, and that why you would want to do that. So we would expect you to have an interest, and we do have this introductory course to introduce you to that, so to kind of give you a background of qualitative and quantitative as well. But we would expect some kind of an interest and understanding of that, like, so we can build on that as well. And you can talk to us. You can email me as well, and we can discuss if you have concerns. For those kind of specific questions, I'd probably need to talk to you and see, because if you're in a very completely different field, maybe there might be, discussions to figure that out.
Okay, I see another question somewhat along the same line about research. This person, Kyra, asked, if I already have an idea of what I'd like to do for potential research, can I do the studies as part of the research track? Will NUS be able to facilitate this? I think she meant she may have some international experts in mind that she may collaborate with to fulfill the research component of this master degree.
As long as we have ethics in Singapore, if it's an ethics project, as long as if we go through all of that, there is flexibility for something like that. Yeah. Again, we're kind of more driven by you as well, potentially. But yeah, there is definitely flexibility for that. It's, but we would encourage you to have a supervisor in NUS as well, so that we can work together. Because if they were completely external, you might not have access to the certain processes that we would need to do in Singapore.
Yeah, so basically, I think everything that you intend to do, you can always bring it up with us, and we're happy to have an open conversation about this and facilitate as far as we can, as much as we can. Okay, so I see some questions here that I can lump together and I can answer on behalf of the team. First is, are the lectures face-to-face apart from the two e-learning ones? The answer is yes. Most of your classes are face-to-face classes. There may be certain weeks where we have a guest speaker, for example, and she's over in Canada, and then that person will dial in online. Or some weeks you will have self-directed learning where you're invited to review some materials online. So those weeks you may not have face-to-face class. But other than that, those are the exception. Most of your classes, as long as they are not part of the two e-learning courses, will be all face-to-face. Are there any other NUS scholarships? There are NUS scholarships, but this master degree program is fully self-funded. So most of the scholarship programs will not apply, as in the ones that are offered by NUS will not apply to us. You can again seek company sponsorship, or there are other scholarship options out there that are offered by various foundations or philanthropic organizations that you can apply to and seek their willingness to sponsor you on this master degree program. But we have been in conversation with a couple of the philanthropic organizations to consider sponsoring scholarships for our master degree program. So if you are keen, then we can continue this conversation. You can drop us an email at busylearning@nus.edu.sg. I've already put it up in the chat, so we can have further conversations from there. Okay, dependent pass holders. I think this is a question that I will not be able to give you a straight answer now. Maybe we explore this further, Lynn, over email. So you're a dependent pass holder. You're wondering if the deadline of the application applies to you. I think as long as you're residing in Singapore, you're considered a local applicant. So the 31st May deadline would then apply to you. If you're not full-time in Singapore, you've permanently or you're majority of the time living somewhere else, then you may be considered international applicant. But I cannot give you a straight answer right now. You can email us and then we can see which of this is more applicable for you. Okay, somebody asked, if I start on full-time, can I then convert to part-time later on? So the answer is yes, you can convert to part-time anytime within the 2 years. So even if you apply as a full-timer, the academic workload for a full-timer per semester is 3 modules or 3 courses. So in order to graduate within 1 academic year, you need to take 5 on average per semester to fulfill the 10 course requirement for graduation. But you can take your time and just do the minimum 3, which means you will naturally exceed the 1-year requirement. So that way you're kind of already extending your candidature naturally without having to officially convert your status into part-time. But should you really struggle and something unexpected happen during the time that you're on studies with us, we can apply for you to convert to part-time anytime. Converting back to full-time is also possible. So I hope that answers that question. I see another one that asks, can full-time master students study on campus? So I'm not sure what do you mean by study on campus, but all of our face-to-face classes happen on campus, specifically within.
I think can they stay? Is there accommodations available? What can they do for accommodations? I know you're trying to do all of this, Jen.
I'm trying to clear the ones that I can answer. So unfortunately, the on-campus accommodations are primarily reserved for undergraduate students. So for a majority, or in fact, I would say all of our master degree programs, if students, if they're coming from overseas, they seek accommodation outside, meaning rental flats or apartments. They are around the area in Clementi or Novena and various places like that. So I would say probably the answer to your question is a no. Okay, then let's go back to a question that maybe Eva can answer. What is the current student demographic and background composition? Percentage of nationalities, age, percentage in healthcare experience. Are there any non-healthcare disciplines? This person is interested in the diversity value in our master degree program.
Yeah, so somebody asked from an economics background. We do have a good percentage. I'm sorry, I'm too tired in the evening to think of percentages, but we do have 4 or 5 at least economists. We have human resources people, some biologists who are coming from biology. That's my background originally, is basic sciences. And then we do have healthcare people as well. We have 1 or 2 pharmaceutical people. and I can't think, and maybe a couple of accountants as well. So, but they're all kind of leaning into and marketing, some kind of marketing background, which is handy because a lot of them have the research knowledge because they do a lot of quantitative research. So they have that kind of methodology understanding as well. From an age group, for this cohort, a lot of them are just finished their undergraduate. So there's like I'd maybe about 30 of them who are just out of undergraduate, so they're in their early 20s, and then we have another subset, about I suppose a quarter of them, who would be in their 30s to 50s. So that would be about 25% of them. So there is kind of a mix, but they're actually, we had pizza with them just before we came here. They're actually all really starting to mix really well, and they're starting to get on and support each other in different ways because they all have, again, different backgrounds and different knowledge as well. So that we're kind of, I think the initial thing, everyone was kind of stressed, but they're kind of getting to build and kind of get to know each other because we make them do a lot of group discussions. So they have to talk to each other all the time. So they've all kind of slowly been making friends. Yeah, and nationalities, we have Chinese students, international Chinese students. I think they're mainly our international cohort at the moment, and we have Singaporeans, and a lot of them would be kind of healthcare backgrounds, and they are coming with their projects. So the cohort for the part-time Singaporeans, we actually have a small group of them working on their projects in this semester. So we're kind of working with them because they're more specific projects. So we have a bit more time with them as well. So which is valuable if you did want to do part-time, because we could really focus on that as well. So yeah.
I think mostly what Eva said is accurate. We don't have like the numbers in our head right now, but majority you can tell. Most of the master degree programs offered by NUS right now is the same trend. If they are fresh grads, they mostly come from China. For postgrad students, they are mostly part-timers and they're mostly Singaporeans. We do see some applications from around the area: Philippines, Indonesia, Thailand, India. So you will see a more mixed cohort for the second intake than the first intake. The first intake is pretty uniform in the sense that we have majority Chinese students and some local students. But in the next cohort, based on the application that we've received so far, we will see a more mixed cohort for more people from other countries around the region. In terms of background, yes, we mostly I think 100% of the Singaporeans who are on our degree program are in healthcare, working in healthcare, or has been in healthcare, or will be in healthcare. The international students, some of them have working experience or internship experience within the healthcare sector or the pharmaceutical sector, but I would say 50% of them come from other backgrounds, such as HR, finance, marketing, accounting, and things like that, and even communication. So I hope this gives you hope that even if you do not have a good background in healthcare or health-related field, you are still welcome to apply, and we still review your applications with due diligence, and we'll consider you very seriously. I have one question here that I think, Nick, you can answer. It's a question that we get quite often. It's about MPH, right? MPH program have a behavioral science domain. What are some of the differences or overlaps? What does BZ teach or offer that is different or similar?
Yeah, so I think we do get this question a few times. So essentially, if you think about an MPH, it's essentially looking at population health and facing populations engaging or not engaging sort of health behaviors, and how do you sort of shift that. As I saw the question, I went on the MPH program in NUS and checked this out. In fact, what they seem to have is not behavioral decision science, is health and communication. This is a different field. Essentially, health behavior, how you communicate around health behaviors, risk communication. That's what, and I haven't seen the course in detail. This is what they're looking at. Under behavioral decision sciences on our end, we focus both on people exhibiting those health behaviors, but also healthcare providers, how healthcare providers' biases or the ways of processing information may or may not help implement best evidence at the point of care. We also look at different ways of conceptualizing decision making, using, for example, operations research models, and sort of marrying up those models with what we learned from implementation analysis of barriers and drivers. So essentially, we take a view that this isn't just about population health, because we also look at healthcare intervention kind of implementation technologies, and also we have a very I would say, emphatic focus on healthcare providers as the people where we intervene rather than just intervene at population level. If you're massively interested in sort of population level intervention, an MPH would be the sort of area that you want to spend most of your time. And essentially, they would describe this as a behavioral epidemiology kind of work. If you're interested in working with both healthcare providers as the subjects, if you like, or participants of change programs and residents or the population at large, then behavioral implementation sciences is more like your cup of tea. This is how I would sort of very roughly categorize the two. Is a change in a difference in focus and emphasis. Essentially, we do share. There is a Venn diagram that we do share some of the methods and frameworks, but we do not fully overlap.
Thank you very much, Nick. Eva, anything to add?
No, that's perfect. Perfect
All
answer.
right. Thank you. I see a question that just popped up about whether the application will be reviewed on a rolling basis. Yes, it's on a rolling basis. So the earlier you submit, the earlier you hear back from us. We've started processing the application. So I think the first batch may hear from us within the next month or so. I see a question that says, do you have health coaches? Eva, is this something that you want to answer?
Yeah, I wasn't sure if you meant, do we have health coaches as students on the course? We don't currently, but definitely we'd be interested in health coaches applying to be students. We don't have health coaches like working as support, if that's what you mean, as teachers in guidance from the course. I'm not sure if that's what you meant, but we have other kind of coaches who work in the kind of coaching area and practitioner area. But I'm sure, yeah. So I don't think we do. Do we, Nick, have any? No, not specific health coaches, but they definitely would be interested in working with you or being involved in the course.
Okay, I find it surprising that we've gotten through to all the questions that I can see so far. I do recall that Claudia and Bao Xuan, you had typed your questions in the chat, but I cannot find it anymore. So if you want to reconsider what you want to ask us, please drop us an email. The email again is in the chat. Otherwise, maybe we just give everyone another 1 or 2 minutes to see if you have any other questions that you would like to ask us, and you can quickly pop it into the Q&A or the chat function.
There was one question that I had written a response, but it didn't go to the group. It went to the host, and they had asked about the behavioral decision sciences. Do we split it into age and strata in the course? And I don't think I know they will talk about different research projects, and they might talk about age and strata, but they wouldn't do that. That's not specifically we're going to look at adolescents, or specifically we're going to look at older adults or whatever, but they would definitely talk about examples, and they would use that. And that's something that you could do in your research project if you're interested in that. But the course isn't specifically set at adolescents or set at a specific strata or age at the moment, because we want it's a master, so you kind of want to introduce the kind of thing around it, and then you can focus where you're more interested.
All right, thank you for getting to that question. Is there a PhD for this course? The answer is yes. We have how many now? 3 PhD students under Nick. So yes, you can apply to do a PhD in Busy. It's a separate process. It's a separate application platform.
Yes, it's a separate process, a separate application, separate degree. So just to be clear, we do support PhDs, but it's a separate pathway, as it is in all universities in the world. So taught masters and a PhD by research, they're different degrees. But we do have one. Very happy to talk to you about it.
Yeah. So if you're thinking about doing our master degree program and then follow on to do a PhD with Busy, then you're more than welcome to do so. Because as a requirement for PhD application, you need to have a NUS requirement is you need to have a master degree certificate from a university of good standing. Yeah. So you can complete this master's and then do a PhD. That's no problem at all. If there are no further questions, and we are almost on the clock for 8 p.m. Thank you everyone for taking time to attend today's info session. It was lovely to interact with all of you, and we look forward to receiving all of your applications. Again, if you have any questions, then you feel free to reach out to us at our email address, which is in the chat. Again, just for easy to remember, it's called Busy Learning, BISI Learning at nus.edu.sg. Once again, thank you for your time, and we look forward to hearing from you or seeing you at our next engagement session. Thank you. Bye.
Thank you.